Hey there, today I want to talk about something that's changing the game for cancer patients everywhere: off-label drug use. If you're battling cancer, you know how tough the journey can be. The side effects of traditional treatments like chemotherapy can be brutal. But what if I told you there's a way to potentially make your treatment more bearable and even more effective? This is where off-label drugs come into play. Off-label drug use means taking medications approved for one condition and using them to treat cancer. Imagine a diabetes drug like metformin being used to lower the risk of breast cancer, or Celebrex, typically for arthritis, helping to prevent colon cancer. Sounds pretty innovative, right? Off-label drugs are categorized in a few ways. First, some of these drugs can replace chemotherapy, offering a less aggressive option with fewer side effects. Second, they can be used alongside chemotherapy to boost its effectiveness or reduce side effects. Think beta blockers minimizing heart damage. And third, some off-label drugs are used to tackle those nasty side effects directly, like nausea or neuropathy. One of the most inspiring stories comes from Jane McClellan. She survived cancer twice using a combination of supplements and repurposed drugs. Her book, How to Starve Cancer, is a beacon of hope for many. But here's the catch: repurposing drugs is not something you can do on your own. Always consult a medical doctor. If you're curious about how off-label drugs could fit into your treatment plan, platforms like Heal Navigator can connect you with an oncologist ready to help. So don't lose hope. There are options out there, sometimes in the most unexpected places. Visit healnavigator.com for more info.